So this affects our ability to diagnose things in a couple of important ways. First of all, it allows us to look at the retinal vasculature without injecting anything into the patient, which we've had to do before, and it also allows us to look at it very frequently. So I think we still have to figure out a lot of things about OCT angiography, but it's going to allow us to look at disease processes more frequently and with less risk. So we're going to have more information to deal with, and we're going to be able to treat people more in real time based on changes in the blood flow or the movement of blood in the back of their eye. So I think this is something we're going to figure out as time goes on, but the amount of information and the rate at which we're getting this information is really going to change the way we practice a lot of retina. We've never had the ability to look at the retinal vasculature in so much detail so frequently. Before, you would do a fluorescein angiogram on a patient maybe a couple of times a year. Well, now we can do this OCT angiography almost every visit, and some patients are getting monthly OCTs. So we can really evaluate the changes in the retinal vasculature in real time, and I would be surprised if that doesn't change the way we manage the patients. Usually with any kind of innovation, first you have to be able to see the changes and understand the pathology better before we make therapeutic changes in how we manage the disease. And we're at the point where now we can see those changes, and I think in short course we'll be changing our management plans to match that additional information.